We are live.
Okay.
Right angle.
Turn off our phones. There you go. Okay, I'll reconvene our meeting at 1 o'clock. This is a working meeting with the Broadwater County Commissioners, Teresa Munson and Michelle Beebe, and we're talking about the administrative assistant position in public health. So Teresa, you want to go ahead and kick it off, please?
Yes. So what I just wanted to say was when I came to public health 4 years ago, Diane's job was that of just a basic office assistant. Her duties included answering the phone, scheduling appointments for immunization and WIC. She took care of the incoming and outgoing mail. She greeted people as they came in the door. She handled registration forms for WIC and immunizations. Monthly, she counted the vaccine inventory and did the data logger information and sent that to the state. She made up daily logs for the homemaker program and assisted with some ordering of supplies and occasionally took a blood pressure when the nurse was busy. Now she's taken on many, many roles, is wearing many hats, and I feel like she's above the level of an administrative assistant, or at least above the level of the pay grade that she's at right now. We prepared a list of Diane's everything she did. I just did that this weekend with sitting in my chair. Through her willingness to learn and desire to help and be a part of the team, she's become an invaluable member of the public health department. I'm confident in Diane's abilities to run the office with little or no supervision when I'm out of the office. The fact that she's not a nurse only limits her, and the fact that she can't give shots. She's completely taken over our billing department. I was doing a little bit of that, and I taught her, and she self-taught herself the rest of it. It's a very big job. She's been doing a very good job with that for about 2 years. She completely manages the homemaker program pretty much independently, with very little supervision from me. Only when we have some budget issues that come up from the state that we didn't anticipate, then I help her with that a little bit. So now with the pandemic, she, of course, has taken on contact tracing and case investigation. She handles 8 to 10 cases a week on her own. She also takes a standby call every other weekend, so I don't have to do it myself. And now we have Cammie, so she's helping with that as well. She had her first weekend on call 2 weeks ago. So just please consider giving Diane a salary increase based on her exemplary work and ability to make our office run smoothly and efficiently. So we did, with Michelle's help, I did redo her job description this morning, added in, she already had a way more than an administrative assistant. When I Googled that information this weekend, basically an administrative assistant just answers the phone and greets people, does the mail and stuff like that. In some instances, I realized that, every job is different. Some of the things on her job description actually were on my job description. So we did take away a couple things which we no longer have, and added in some of the important things that she's taken over. And so then the other 3 pages is just a list of things that she does on a daily basis or a monthly basis, so. This is what I came up with, but I don't know if that could be using that or not. Today she told me she needs roller skates.
Okay. So the one that you gave us is the updated position as you think it should be, right? The one that you handed out to us, the job description. This is the one that you worked on and updated, is that correct?
Yeah, we just updated it today. Of course,
Yeah.
Michelle and Debbie have to approve that. But
Sure.
we just wanted to have the stuff in there that she does, as opposed to the last job description on file.
Right. So the items that you've updated or added to this list, is this things that she will continue to do always, or is it just during now
Yeah,
because of the
and
pandemic?
that's what Michelle asked me too, as far as, obviously we're gonna be dealing with COVID for,
Mm-hmm.
a long time.
Right.
But now that she can do MIDAS, which is a Montana infectious disease information system, she can help with that, which is a very big job. And I know that Heather and I have talked to you about that before. We have to do all the communicable diseases, whether it's Campylobacter in the summertime, somebody gets bad food at the fair. We do a lot of hepatitis C, we have a lot of chlamydias, stuff like that. Isn't necessarily something that a nurse has to do. It's just information that we, input into the data. So with those cases right now, she does COVID completely on her own. With those cases, she helps me get medical records, and stuff like that. So that's something that she probably will continue once COVID kind of slows down and goes away. And it's a big job. Sexually transmitted diseases, people don't realize how many we have in this county. There's times when we'll get 8 at a time, and you have to investigate every one of them. And every one of them takes, at least an hour just for the data entry. And, then you have to talk to the patient, to the doctor, that kind of stuff. So it takes a considerable amount of time that I don't have. And so Heather was doing that, when she was working there. And since we don't really know how our staffing is going to go, Diane would be the one that probably will be doing MIDAS.
Mm-hmm. I know we haven't hired our full-time LPN yet, right?
Right.
So we're still kind of working on that.
Yeah.
So once that happens and you get your full-time LPN, do you think that she would maybe take over some of these duties that Diane is doing right now, or?
Well, I was actually hoping that they would, help me take a little bit off of my plate. So,
Mhm.
you know that the information that we got from the state said that we have to have one full-time FEP person. And that's an emergency preparedness person. And, right now, I'm barely at half-time doing FEP. And, the state understands that right now because we're going through COVID. But once COVID has calmed down, they're going to expect the same level or higher level of grant work that I have to do, which lessens all the time that I'm going to have to do everything else. So Heather was doing immunization grant, the maternal child health grant, and the farmer's market, which Diane took over the farmer's market. So that gives those grants back to me. It takes so long to teach somebody how to do grant work that right now I don't have time to teach somebody. And the state says it takes about 1.5 years to learn how to do the FEP grant. So we're talking, quite a while, even if I get somebody to help me do that. So looking at some time down the road before that happens.
I know one of Diane's bigger jobs is the billing, right?
Right.
So is she going to be able to continue to do billing and
Yeah.
and keep up with that with some of these extra duties?
Right, and so we only had one application for the part-time administrative assistant, and so I just got an email from them today and asked if I wanted to set up an interview. And I just haven't had time today, but it looks like we only have one person to choose from. And that will give Diane the time she needs to get caught up on billing. So, because billing is really a period of time from, we usually start school shots somewhere around May to July, and then of course all the flu shots and stuff. So it takes usually anywhere from, I would say till March or April to get billing done. And then you only have a few months off and then you start all over. And it's not that you don't do any billing in between, but we're talking mass billing, like for flu shots and stuff like that. So she's been trying, but it just, the phone rings off the hook. She's also doing, case investigations, and they take so much time, so we just,
Right.
Without an actual company to do our contact tracing, we're just splitting it up and between me and Cammie and Diane, so.
Okay. So right now, you guys are still getting some overtime and on time or on call pay, right? Is Diane doing that as well?
Yeah, she's taking on call too.
Okay.
Yeah, because there was 14 weeks that I was on call every weekend for 14 weeks when I came back from my surgery, and so Diane learned how to do it, and lickety split. So.
And is she also getting overtime now?
She gets standby pay.
Standby pay.
Yeah, and overtime if she works.
Okay.
We try to limit our overtime, as much as we can, but, if you get 5 cases, like 7 cases will take an average of 5 hours. So you have 24 hours to contact every person that comes in that's positive, whether it's Saturday at 4 or Sunday at 4, whatever the case might be. The unfortunate thing is the cases come at 6:15 5:55 a.m. and 4 p.m. And so the 4 p.m. ones, we can't even possibly get done by the time we leave, so we just leave those till the next day. But on the weekend, you can't do that, so.
Michelle, from the budget impact standpoint, where are we at?
Well, with the different grants and all that stuff with her budget, and some of the, like COVID money and everything, it's kind of all over the place right now.
Mm-hmm.
So on one hand, she got a lot of grant money, but then on the other hand, you probably haven't been able to do a lot of your typical stuff that you normally do, so you might not have as much revenue coming in for your billing. So I mean, there's kind of a back and forth on that.
A little bit of a trade-off. Okay.
So, depending on, you know, what you're possibly looking at, I mean, we'd have to have kind of an amount, and then we could tell you more exactly how much it would impact the budget, but more than likely it would be not enormous, but it would be with everything else going on, it's kind of hard to say what truly the impact would be right now, because especially with her department.
I guess what I would like to look at is, I know that right now there's some vacancy savings, and I think in the interim, probably something would be fine, but I want to look into next year's budget as we move into next year's budget. And we do hire the full-time LPN. Maybe things will start to normalize a little bit, I don't know.
Right.
But I guess that's where I want to see where that impact will be. Because I don't want to be counting on grant money or COVID relief money to infuse the budget.
Right, for going forward.
For us
I mean,
going.
it is right now, but
For us
not
going forward. Yeah.
To next year. If I can get, you know, some kind of amounts that you're entertaining or that you're looking at, we can go in and we can tell you pretty much how much that would impact the budget down to, you know, almost the cent, because we have a worksheet that we can put in there.
Right.
But we have to just kind of have a few amounts to work with so we can see, you know, what we're looking at.
Okay.
And we can do that.
All right.
Well, I was looking at 19, which I know is under median for her job description, so I thought that was fair. Because right now we have 2 very part-time LPNs, so and neither one of those are collecting budget benefits. And going forward, if we do end up, you know, keeping 2 part-time LPNs, we wouldn't have, you know, insurance and benefit issues, probably benefits, but not insurance, so, which I know is a big chunk of money.
Yeah. So Teresa, you're in tune with your budget. How do you feel that amount would impact your budget? Can it support it, knowing that you need to hire your full-time LPN and some of these other things?
I do.
Yeah.
We just haven't been able to work really hard on the stuff that was making revenue before. You know, Cammie has picked up the foot clinic now. That was kind of on hold. We just didn't have the staff to do it, so we're back doing the foot clinic. We did give a lot of flu shots. We just don't have the revenue because we haven't got the billing done. So, you know, I don't think, you know, that amount is gonna, you know, is gonna impact our budget that much.
Okay. Well, we'll see what Michelle and Debbie get for us. What other question? What do you guys got?
I say it your hope to, excuse me, hire a full-time LPN this fiscal year?
If I have to keep two part-time, I'm fine with that. If, you know, I just because, you know, you want to pick the right person, and I haven't had such good luck with that. So, I'm hoping to pick up, you know, the right person and, you know, go from there. And I want to be sure I have the right person before I offer a full-time position. So,
But you would like to get a part-time admin assistant? Again, as soon as you find the right person.
yeah, we need to right now, just because the phone's ringing off the hook and we're
That's
never
more
gonna-
for just temporary for
It's
COVID.
temporary, completely temporary,
Yeah.
just so we can get some of the billing.
Okay.
You know, the longer we don't do billing, the longer we don't have that revenue. And it's a lot. I mean, I think we're talking like 35, 40,000 usually in flu
From the
shots
flu
and
shots, yeah.
pneumonia
Oh.
and Shingrix. You know, we did a lot of Shingrix in the last couple of years, but there's a lot of people that still need them. But, you know, now with the COVID shots, you can't have both at the same time, so those are going to be kind of put on hold for a while too, so.
And COVID shots are more, is the government providing you those, like,
Mhm.
just for free? So there's no
Mhm.
cost to you?
No.
And then you're not charging anything on the other hand, right?
We are.
Okay.
And I don't know if that'll change or not, but I did send Daryl an email on that, but I know most of the other counties, at least right now, are not charging an administration fee.
Right.
So, and it, you know, so we did 20 of them last Wednesday, I think. It pretty much takes the whole day, because they have to be there for 15 minutes.
You have to observe them.
Uh-huh, yeah. So it's a lot of administration time that's pretty much lost, you know. But for right now, you know, that's what we need to do. And I honestly think that we're gonna, well, I know we're going to get some reimbursement for that from the feds. They just haven't decided what it's gonna be or when it's gonna be. But they realize that all these facilities are using their nurses and their nurses' time to do these vaccines and not getting reimbursed for it. So, on a few of my meetings, there's been talk about federal money coming down for help with administration of the vaccine. So.
Okay. Guess I don't have anything else. You guys got anything? Any other questions? Michelle, you got anything?
No, I just, now that I have the job description and stuff, I can kind of work through and
Can you
figure
kind
out that 19, and I can give you
19.
guys some information and everything that you guys need.
okay. And, you know, I guess the thing we need to, we know that Diane is in this position and she's doing this great work, but we need to keep in mind that it still is the position itself.
Right.
Right.
Mhm.
So then it's hard not to do that, but.
Right. This, where it is in the matrix and everything else will stay that way, even if Diane is not.
Even
in
if
that
Diane's not
position.
there.
So
Whoever's in that.
It's
Right.
with the position, not the person, but when you only have one person in that position, it's hard to not
Right.
equate it to that person.
Yeah, exactly. Okay. Well, I guess I don't have anything else. Teresa, you have anything else? No? All right. I guess we'll go ahead and adjourn at, 1:25.
Yes.
Thank you, Teresa, for coming over.
Is this for me? This one here? This.